All right, hey guys. This is a re-recording of the lecture on applications of observational methods. So let me share my screen, and we'll get this done. Sorry for the cough in advance. So I will try to not do that as much as possible, but can't make any guarantees. Okay, so here's the deal, right? We started talking on Tuesday about observational research. Um, And we know, right, that obviously for any of you going into healthcare or any healthcare related field, a lot of you are going to be pulling a lot of your high quality evidence that you use in everyday practice, generally um, from a lot of observational studies, whether that's epidemiologic data, whether it's cohort studies or randomized controlled trials, right? Those all fall under this umbrella. Okay. So, like we were just saying, right, observational methods, is used obviously in clinical sciences, public health, sociology, epidemiology, so on and so forth, right? And like we talked about Tuesday, the primary goal is to assess the effect of a risk or disease on an outcome, right? So the risk or disease is generally our independent variable, right? Those are synonymous, right? Whereas the outcome is usually our dependent variable, and that's synonymous from experimental studies as well. So risk factor, okay, or disease equals independent variable, outcome generally equals a dependent variable, right? Um, and obviously, like we talked about, we are not manipulating any variables. This is simply happening, right, in the natural environment, and that is one of the main ways that um, that our observational studies or quasi-experimental studies differ from experimental designs. Um, so the other thing also to remember is that we can examine our data in two ways. Okay, we can examine that data longitudinally over a long period of time, right? Generally prospectively from our current point in time onward into the future, or retrospectively from our current point in time into the past previously. Okay, so those are our two main ways of conducting observational studies as far as methodology goes. So here's an example, okay, of a cohort study. So let's say that we wanted to obviously assess the effects of tobacco use and or vaping, uh, slash e-cigarettes, right, on the development of lung cancer or lung metastases, right? So um, let's say, for example, that obviously tobacco use and or e-cigarette use is our risk factor and lung cancer is our outcome, okay? Now, one thing that could possibly kind of derail us in regards to um, making a pure cause and effect relationship, right, that's true and balanced within the study is the presence of what are called cohort effects. Okay, cohort effects very often, as we'll see in a second, are generational differences in exposure to the risk factor. Okay, due to many different reasons, whether that is uh, known increased prevalence at a certain time and or other factors like media exposure, which we'll talk about in a second, right? So one of the examples we brought up on Tuesday of confounding factors or cohort effects within cohort studies was the advertising surrounding tobacco, right? In the 40s and 50s, prior to tobacco being linked, obviously, to lung cancer and generally speaking to respiratory disease, right? So let's kind of dive in a little bit further into these cohort effects. Generally, if we're wanting to break these cohort effects out, we generally define these as either age, period, or cohort effects, right? And these are the primary confounding factors of observational studies that can really obscure the true cause and effect relationship that we're seeking, right, in observational studies. So age effects, right? These are generally biological and sociological factors associated with the aging process. Okay, this is very much synonymous with maturation in a lot of our experimental designs as a threat, right? So, uh, in an example here, obviously, as all of us get older, the chances that we will develop some sort of condition and or generally be less healthy are higher by and large, right? Period effects, right? These are essentially effects based on uh, being based on being involved in a study within a certain time period, right? that's independent of birth year. So, for example, let's say that we want to look at essentially rates of malnutrition, okay, in a cohort um, of people that are 20 all the way to 100 years of age, right? And so we have people that essentially were born into and or lived through the Great Depression within that cohort. The problem, though, with including that group of people in our cohort study is the fact that within the Great Depression, food scarcity was much more prevalent than it is now, right? Um, and malnutrition would have been, right, uh, a more prominent factor, right, and or potentially even inflated more because of the widespread unavailability uh, of healthy food and the cost, right, and the lack of economic access to food, right. And so, generally speaking, people were eating less, right. And so, one of the things that I think goes without saying is that if people were consuming less food, it's definitely possible that there were, uh, you know, definite impacts, right, on nutrition. So malnutrition was much more common then. Um, there can be obviously cohort effects specifically linked to birth year, right? So those born obviously in different years have different biological and sociological characteristics that can obviously obscure cause and effect, right, within a study. So for example, let's say that we were wanting to kind of just overall kind of take a survey of the overall college experience of students, right? That were in college between the years of, let's say, 2020 and 2026, right, in the future. So we know that because of COVID and a lot of the shutdowns in the year 2020, that many classes were moved online, students were sent home, and so many of them did not have the traditional college experience that many of us either had and or are having now, right? So that is an example of a cohort effect that's linked to birth year. So generally speaking, age effects and period effects are generally a lot more common. Um, so case control studies, right? This is a main design of observational methodology, and this is generally a method of epidemiologic investigation in which essentially we have one group, excuse me, with an outcome or disease of interest, and we compare that to a control group, right, who do not have the disease or condition of interest. So really important to know that are cases in this example. So cases are, right, those who have the disease of interest, and our controls are those who do not, right? I think that is pretty intuitive. Um, it's really important to note too that our case definition, right, also relates back to our inclusion and exclusion criteria. And generally, we in this situation, we're using specific diagnostic and clinical criteria to either include or exclude someone from a case control study, right? Uh, either including them in the case group or excluding them from the case group, right? So a lot of our case control studies are generally retrospective in nature, right, and are usually conducted to identify a risk factor. Okay, so let's look at an example, and this is kind of an exception to the rule, but here's an example of a case control study. Okay, so let's say that we want to assess uh, the effect of being diagnosed with type 2 diabetes on the development of high cholesterol. Okay, so we're curious, right? How does the presence of that, and that actually is a risk factor that actually exists, right? That's a thing. So how does having type 2 diabetes contribute to the development of high cholesterol in general, right? So we can say um, that, let's say that our case group, for example, is patients from ages 45 to 60, right, diagnosed with type 2 diabetes. And our methodology here is that we're gonna essentially follow these patients for 10 years. Okay, this is a longitudinal study, obviously, and we're gonna take metabolic panels from them. We're gonna draw blood, do a metabolic panel every single year for 10 years. Okay, and assess development of hypercholesterolemia and or high cholesterol. Okay, in between these groups. Our control group, on the other hand, are those that don't have so they don't have diabetes. Okay, without type 2 diabetes, same age group, right? uh, and generally don't have any other major comorbidities, right? So we are going to obviously perform the exact same methodology, follow these patients for a period of 10 years, right? And collect those metabolic panels at intervals of 1 year, right? And then, okay, we are going to assess which group has higher rates of high cholesterol after that 10-year period, okay? So that is an example of a case control study, all right, kind of practically worked out, kind of what it would look like. Um, so let's talk a little bit more about case definition, right? We've talked about, sorry guys. Um, so case definition, right? So ultimately, um, our case definition, kind of like we mentioned, is closely tied to our inclusion exclusion criteria, right? So we're obviously including them, based on condition of interest and clinical criteria, right? And that essentially is what defines our eligibility. Okay. Um, so obviously, also inclusion and exclusion criteria are used to within the case definition to define the populations that are going to receive the treatment, right, and those that are eligible for the study. This is going to be really important on in a couple of slides when we talk about randomized controlled trials as well, right? It's going to be super, super important to tightly define and be very intentional about how we define our cases, right? So, in a lot of our case control studies, those can be either community based. Uh, so, essentially patients selected from a hospital setting or hospital based. So, patients that are in a medical institution of some sort, right? So generally speaking, that's how we're going to generally see these studies performed. Um, so the benefit of actually tightly defining our case definition is that, as I'm sure all of you know by now, right, by having those really tight inclusion exclusion criteria within a case definition, we limit our confounding factors. Okay, particularly our cohort effects, kind of like we talked about. Okay, randomized controlled trials. Okay, this is where things change just a little bit. Okay, randomized controlled trials are essentially where we essentially have patients with a condition of interest that are randomized to a treatment group or a control group. Okay, so patients in a treatment group are randomly assigned to a treatment group versus the control. Now, going back to the ethics portion of our class, right, when we talked about ethics, super important, okay, in our randomized controlled trials, that those in the control group, if they're not receiving an experimental treatment, they have to receive the standard of care at a minimum, right? Pardon me, because as we know, we are not allowed as researchers to place participants in undue harm within a study design. Okay, so um, and obviously, as we also know, randomization of patients into a control group or treatment group controls for confounding factors, right? Balances those across both groups, um, and essentially neutralizes the impact of other diseases, right? Um, so one of the major problems that we often see though in randomized controlled trials is mortality, which is people passing away during the study, right, and or attrition, people simply dropping out, right, choosing not to continue in the study, which is their right, right. Obviously, though, in patients that are sick, mortality can be a big factor. Okay, randomized controlled trials. So here's an example. Okay, so we can see that we have obviously, 100 patients here. Let's say all of them have, diabetes, for example, and we want to assess um, a brand new dietary change, right? We want to actually assess um, the effects of a new therapy administered to the gut flora, right, to help manage blood glucose as opposed to conventional medication. Okay, so we're essentially randomizing our participants, all of them have diabetes, into one group or the other. Okay, so um, randomized controlled trials, right, given this example, represent a super high level of evidence in clinical studies. And these are things that are very, very often cited in a lot of clinical journals and or healthcare journals, right, as uh, really significant and well-controlled forms of evidence, right? So as we've talked about, really important to remember that both the control group and the experimental group both have the condition of interest, right? And we know, as we've said, that the control group has to receive the standard of care. right? In order to ensure that we minimize the risk and maximize any potential benefit. Um, so ultimately, if we're attempting to prove that a new treatment is equal to and or just as effective as a gold standard, right? That ultimately means that that new medication or treatment, um, you know, might be more cost effective, right? Generally speaking, you may also see these types of trials referred to as non-inferiority trials, right? So ultimately demonstrating that this new treatment uh, is not inferior to the gold standard, right? And potentially maybe has more benefits than the gold standard. Okay, so that is often something that you may see um, in a type of randomized controlled trial. And statistically, generally speaking, we would be looking for uh, a truly, I mean, generally probably a t-test, right? Looking at whether or not the groups were actually the same and or whether there was a directional increase, pardon me, in differences between groups between the experimental group and the control, right? So what are some threats to observational research, right? So obviously, observational research, although it possesses a high level of external validity, right, there can be threats to methodology, which can threaten our internal validity. Okay. Um, One thing that can very often become a problem, particularly in clinical trials and in cohort studies, is that when we study disease, there is such a thing known as the spectrum of disease, right? Meaning that uh, people can have people that have a disease, for example, like diabetes, and or even things like rotator cuff pathology, right? So uh, all of the both of those clinical problems have a spectrum of disease from being essentially mild and or controlled to highly uncontrolled, right? And or highly debilitating, right? So it stands to reason that wherever someone is on the spectrum of disease, if they're obviously not as ill or the condition doesn't impact them as much, as opposed to someone who does, right? That is going to essentially represent a threat, right, to our observational research. But we know, okay, based on the conversations that we've had in this class, that a way to essentially overcome uh, that confounding factor is potentially the use of stratification, right, inside of a study. We know about selection bias already. Okay, that's when selection bias occurs when participants are selected based on specific characteristics of severity of disease without randomization. Okay, we can also misclassify people actually, right? In observational research or in randomized controlled trials, right? And that occurs when subjects are incorrectly assigned to either the experimental group or the control group. Um, So when misclassification does occur, generally we break this up into two different types, right? So there is a type where if misclassification occurs in both either the control and the experimental group, right? Um, in the sense that we've assigned people to both groups incorrectly, right? This is referred to as differential misclassification, and that may obviously weaken the impact of our risk factor on our outcome, right? So let's say, for example, that we incorrectly uh, classified people or misclassified people to only one group. Maybe, for example, that is the control group, right? And so that essentially that might deflate the impact of the risk factor on the condition of interest, right? So non-differential is when we essentially misclassify participants to one group, whereas differential is when we misclassify participants in both groups. Okay. All right. So guys, that is it for today. That's the lecture, right? So don't forget about quiz 4, still open, right? That closes at 11:59 p.m. tonight. Um, Please, if you can, please watch this. Um, Once again, sorry that we weren't able to meet in person today, but I don't want to take the risk of getting anybody obviously sick. God willing, we will be back to normal in person on the Tuesday, having a work day. Okay, you guys have a great day, and appreciate you guys. Okay, thanks.